Hello and welcome to our program Where God Weeps. Today we're going to be considering the country of Kenya, a nation with a population of some 37 million, of which fully 1/3 are Catholic. To tell us more, it's my great privilege to welcome Bishop Alfred Rotich, the bishop, the military bishop for all of Kenya. Your Excellency, thank you for being with us here today.
Thank you.
Your Excellency, your name is Rotich, and it's a bit curious because I'm living in Germany, and Rotich sounds like almost a Germanic name, but in your country, in your language, it means something. It has a special meaning. What is the meaning of your family name?
You must be having a musical ear. This is good. In my family in Kenya, Rotich means that my father was born at the time when the cows were really processing for milking in the dairy, and that is about 3 o'clock in the evening. So I took the last 6 digits of the letter of the name of my father, and I'm called Arab, the son of Rotich. So basically it means shepherding. It's processional, and it happened that I now lead a procession of
I was just going to say,
church, yes.
It's nice, this prophetic, the words that you are also a shepherd for the church.
Yes.
Your Excellency, you are also a colonel for the armed forces in Kenya. How did this come about?
Well, it came as a ministry of the church. I was sent by my bishop on the request of the cardinal of the country, who was then the bishop in ordinary, late Maurice Cardinal Tunga. And on invitation, I had to obey, to go there as a chaplain to the armed forces. Later, after 10 years as a chaplain, I was ordained a bishop. So it is a part and parcel of our pastoral work in our country that the armed forces of a country is given an opportunity to have the reason for their faith, and they be chaplained by the indigenous clergy.
Are there a number of Catholics in the military? What percentage of Catholics would you say are in the military?
There are a sizable number, yes, of Catholics who come to our chapels. And from what we see, we would say that they are God-fearing people, yes.
Kenya is one of the economic powerhouses in Africa, and yet at the same time a great majority of the population live below the poverty line. Why is there such a disparity between wealth and poverty in Kenya? How did this come about?
I think, when people are selfish, then when it comes to sharing, they want to lift the best to themselves. But I think it has provided an opportunity for reflection and discernment on how this is done. When there is a level of, say, corruption, when there is a level of selfishness, then the rest of it, there is already a demarcation, and there is already a line that divides between the rich and the poor. Richness here maybe is superficial, because the richness of a country is an endowment that people are given a share of the good that is present in the society. So this has been a challenge, and I'm sure all leaders are trying to grapple with this idea.
What opportunity is the Bishops' Conference taking in trying to address this poverty, this question of poverty, but also this question of the disparity of wealth in Kenya?
The bishops have come out with pastoral letters appealing to the the society, especially the leadership and all people of the country, to look at the human person, that the human person need to be at the center of development.
The dignity of that individual.
Yes, the dignity of an individual. And therefore, if my brother or sister is suffering, then we need to all eyes to turn to and then raise that concern as our problem.
Now there's another question of listening and dialogue which is ongoing, and that is with regard to the question of AIDS, which has struck Africa particularly hard, in fact the hardest among all the continents. Mm-hmm. We see that approximately 300 Kenyans are dying every day of AIDS. Is AIDS increasing in Kenya, and why is AIDS so prevalent in this country?
Well, there are many reasons of why AIDS is increasing on a daily basis. But I think measures have already been taken by the government and civil societies, the churches, to address this issue. While we do not want to judge the person who is affected, we want to be a faithful companion to the affected. And by being faithful companion of the affected, the infected, we become affected. And therefore it draws our sympathy. We need to move towards them in order to, first of all, assure them that it's not all lost.
This is an important question because I was reading that many women, for example, in Kenya, are afraid to have AIDS testing because they are afraid that if the husband finds out, the husband, who is the sole breadwinner often, may leave. And so this question of accompaniment on the part of the church, I can imagine, is very important to this question particularly.
Yes, there are a number of projects and initiatives that have been taken by the church. And in fact, if you go to the city of Nairobi, there is what we call programs in the Eastern Deaneries, and especially sponsored by the church groups, say like Merino, and the supervision of expert priests, and also care providers. And you realize that the church is there and asking the people not to fear, to come to test and realize their status. And of course, being a disease that always associated with extramarital relationship, people would not come directly to say that I have this, because they would be judged by the society. But that is slowly wearing down, and people are advised even to go for tests, even with education during the pre-marriage, and when they are attending courses on marriage. In the whole preparation series of sessions, they are enabled by the church and assures them that their situation is not the end of life, because they will also promise that they have the bad times and the good times. Yes, there have been a situation where the husband has rejected, but there are counseling services that are being offered to the individuals in case this is realized, and to bring a sense of understanding and empathy to the other person.
Your Excellency, we are going to take a break now, and we're going to watch a short report about how the Catholic Church is working with AIDS victims in Nairobi.
Last year we saw 2,300 patients, I think, we looked after. At the moment we've got 1,400 patients. You see, it's home-based. Most people are sick at home. We only put in the hospice those who cannot be looked after at home, either because there's nobody there or because they've been rejected. It may be that it's a mother with young children and there's nobody else. you know, and they can't manage. Not every day. We can't afford it. No. Okay, so we go to the natural medicine. Yeah.
So we're going to the natural medicine now, where what they do is they prepare food for people so that if they cannot take ARVs, they can use this.
Sister Gilles, a registered medical practitioner, has, based on many years' research, observation and trials, drawn up a food and medicine program aimed at helping the human organism fight AIDS and strengthening the body's immune system. She uniquely applies locally available natural products. In many cases, natural healing methods are the only ones available, as antiretroviral treatments, ARVs, based on chemically synthesized drugs aimed to destroy HIV, are too expensive and in any case not always available.
It clears out a lot of the virus from the digestive system, which is where they tend to congregate. And people sleep better, eat better, they lose a lot of their symptoms. And for most of them, the CD4 count goes up. The CD4 count is the measure of immunity. So this is the cabbage. They have to cut them very small. And they put it in water, and it ferments. It is this over here, and it stands for 3 days, and then it ferments. It's a bit like eating sauerkraut. This is Brazil nuts. Brazil nuts are very high in selenium, and selenium is needed to boost the immune system. And then they have what we call pili pili dawa, which is like a chili sauce, which is garlic and chili and all sorts of things, and that stimulates the appetite, it helps them to sleep, and it also boosts the immune system. The cabbage mallet, which we call it, that destroys harmful bacteria and stimulates the growth of the good bacteria. We started the same time as we started the ARV clinic, because we knew there'd be some people who wouldn't be able to have ARVs. Either because their liver was too bad, may have been a bit alcoholic or something like that. People have great hopes. There's ARVs now, and they could get this medicine and they'd be well again. And then they're told, no, they can't have it. It was very, very, very disappointing. We realized ARVs have a limited time span, and they're very toxic drugs, and people do tend to get quite sick with them sometimes. Our aim, as far as possible, is keep people at home, support them at home. The nurses visit the homes. There are 90 voluntary health workers who look after the people in the villages. And we provide them with the medicines, we provide them with this. They come to ARV clinic, they come to the natural medicine clinic. And we provide food for about 130 families every day. So for the ones who really haven't got food and can't manage.
Fighting AIDS and taking care of HIV victims is but one of many activities undertaken by the Franciscan missionary sisters. Since they cannot run separate homes for the elderly, homeless and disabled, the sisters invite all the needy to their own convent situated in the centre of the Nairobi slums. Several times during the week, they open their gates to those in need. They provide food, medicine, clothing, as well as a comforting embrace. Just as it is with the victims of AIDS, the sisters give hope to the poorest.
The Cheshire Home. It's also a daycare centre for the aged and also a place for beggars of Nairobi to come and get washed, have a meal. Many of the people who are working here are volunteers, but a lot of them are young people who are looking for school fees. Most of them should have relatives who could take care of them, and that's the African tradition, that you take care of your elderly. They love that. Their children are their social security. So where are the social security for these ones? Where are their family? And the answer most likely is that a lot of them are sick and dying of AIDS or have already died. Old people who come in, drop in at the daycare center are with a child. Well, it isn't their child. It's probably their daughter or son's child the daughter or son having died, and now the old person is looking after them. So there's really no sector of society that is immune from AIDS. It penetrates everyone, and it has destroyed everybody's life in many ways, because these old people shouldn't have the responsibility of looking after a little child.
Taking care of AIDS patients and the poor, unfortunately, does not eliminate the very cause of the AIDS epidemic. That is why the sisters offer comprehensive educational seminars to the young. Primary aim of these seminars is to prevent further infections, considering 1 in 20 children are infected every year in Kenya.
So you are very good children, I can see that, okay? We're going to go through something today, and the chart is on behind me. So we're going to look at that chart. What is it called? Behavior change process. The behavior change process. What does that mean? What does that mean? Behavior change means what?
The sisters, together with a team of qualified instructors, teach AIDS prevention in local schools. Their foundation is the established Education for Life Behavior Change Program. The program's aim is to guide children and adolescents to personal and spiritual development and teach them the best way of preventing HIV infection.
It must encapsulate the spiritual side, because people cannot change their sexual behaviour unless they are steeped in prayer and in scripture. And the impact seems to be that the children, when they leave the primary school and they meet my facilitators later in secondary schools, they say, "Thank you for helping us to be aware of the dangers of illicit sex."
When we started in Kenya, we were doing a lot of HIV/AIDS awareness, and that included just giving HIV/AIDS information. But we realized that HIV/AIDS information was not enough, because we had nurses and people who were quite informed dying of the infection. And so we learned very early on that we needed to enable people go through change in behavior, since this was the most essential strategy in overcoming the pandemic. And for us to do this, we came up with this process.
We don't stand up and tell them not to engage in sex as such. We let them tell their story. And this story can be, for example, the questions we give them is, why do boys engage in sex? Why do girls engage in sex? And then the other question is, how do girls use their free time, and how do boys use their free time? And when the answers come back, they are truly alarming. And they will say that they engage in sex to feel mature, to feel wanted, and to experience and to explore and to earn money. And then it's also a result of pornography.
The terrifying rate at which people are falling prey to the AIDS virus and the very high death rate amongst Africans was the impulse that lay behind an undertaking involving long-term preventative action amongst the young and adults called Behaviour Change. An Irish missionary sister, a doctor of medicine, was the main initiator. Working very closely with the government, Sister Miriam Duggan developed a programme in the 80s which, based on the HIV infection rate, has to date proved to be the most effective in all of Africa.
I was working as a medical doctor, obstetrician, gynecologist when AIDS came. The first reality was when we began to get many, many patients and many people sick, and we couldn't cope in the hospital with the numbers. I experienced so much pain and so many people sick and dying of AIDS. It really dawned on me that this disease is preventable. I had been involved in giving awareness programs and more statistics and information about how it spread, but nothing seemed to be changing.
The other day I was in a secondary school and I saw the president on a poster holding hands with so many people. Avoid AIDS, be faithful. And down at the corner it said, use a condom. You see, so they have to be seen to promote the condoms. Otherwise the money will not come. That's a known fact. It's money all the time. They don't care about whether people live or die. As long as the money comes into the country, and it's for their pockets anyway, that's the truth of the matter. The corruption is terrible.
It is sad to see that a lot of money, including the government money, is channeled through the bureaucratic government line of operations that do not reach to the village. For instance, most meetings on HIV/AIDS take place in very big hotels, five-star hotels, where people are paying close to $100 for a meal in big hotels, and they don't really reach the people at the grassroots.
So much money is wasted. Right across from our office is Safari Park Hotel, one of the five-star hotels in the country. And yet you will get so many different organizations holding their AIDS prevention programs there. And when you come down to it, it's a lot of rhetoric about condoms, maybe a little polite nod to abstinence, nothing said about be faithful.
The Kenyan government chose for many years to ignore the escalating epidemic, despite the fact that the HIV virus was diagnosed in the early 1980s and has since claimed millions of lives. As a result, the Franciscan Missionary Sisters' work has not been easy.
It was only 1999 that the Kenya government declared AIDS a national disaster. At first, we couldn't even find a place to put an office. No one would give us space. They said there's no AIDS in Kenya, or the government policy is that there's no AIDS. We were having meetings in our car. That was our office was the car. After the disease started escalating to such a great extent that then people started saying, yeah, there is AIDS. And why? Because they were afraid it was going to ruin the tourist industry. They talked about the fact that South Africa has a high infection rate, but they haven't said why. Nobody wants to really bite the bullet and say this country was going to be a prime example for the rest of the world on how to control AIDS using the condom, and it failed. They started out with condoms and they totally condomized the country. They did not prevent AIDS, but nobody wants to talk about that.
We're going against the law of nature, the law of God. So no way should anybody behave like that. People's bodies are the temples of the Holy Spirit. They are not to be misused. And the sooner humanity wakes up to that fact, the sooner that this disease will diminish.
Welcome back, ladies and gentlemen, to our program. We're here with His Excellency Bishop Alfred Rotich of the Military Ordinariate in Kenya, and we're talking about the work of the Catholic Church with AIDS victims in Kenya. Your Excellency, one of the big problems facing AIDS and those affected with AIDS are the children. Many of these children have become the heads of households.
Yes, it is a big challenge to us. But again, in the African society, we were more or less a community. If one is infected, say a parent or a mother or both parents are gone, the society will come around. But you realize now there is great migration to the cities. So when this happens, sometimes the children are left alone.
This community aspect breaks down in the cities.
Yes, breaks down, yeah. And this is one of the values that we would like to come back to insist that we are a family. So whenever there are orphans in this community, the church is trying its best, using all the resources. And the first resource is that empathy. We see congregations of sisters going on a daily basis to manage the situation and to solicit the efforts of the community in trying to help the children.
There is the response of the church, but there has also been the response of of the world, if you will, or many international organizations that have come with the condom answer. You led a protest against the spread of condoms in Kenya. Why are condoms not the solution for the prevention of HIV/AIDS?
Yes, we saw that it's not the solution. And what we called upon the young people at that time not to listen to perhaps the providers of condoms, because we see that it was trying to educate the young people, even at a younger age, to engage in sex. And as you know, the adolescents would love to perhaps even do experiment on this. And we felt that the morality of the country is going down. So as an educational aid, there was need, and especially by the pastors, to speak out against this and to promote abstinence, which is now a program that we have brought to the schools. And as we speak now, there is a curricula in the schools. And now the government, the Ministry of Education, is listening to that area, because they say provision is not the solution, but provision of value-laden system will in turn equip the inner person to strongly come out and say, for this I can wait. There is time for everything, and to wait for the time when they are in a married life. So we said we start with the children. Granted that there have been people who have been affected, does not give us a route or a roadmap to supply things that are foreign to our culture, foreign to our sense of values.
Your Excellency, on these words I would like to thank you for your time and for being with us here today. And thank you, ladies and gentlemen, for having watched our program, Where God Weeps. And if you'd like to know more about the situation of Catholics in Kenya, or about the work of the Franciscan missionary sisters in Nairobi, I would encourage you to look at the contact information at the end of this program, and we look forward to seeing you next time. Take care.